Professor Randhawa, it's great to have you here in the studio with us today talking about organ donation, a subject that's really dear to our hearts. As you know, we're both sitting on the National BAME Transplant Alliance and they do great work. But by way of introduction, just give us a little insight into some of the work you've been doing on organ donation and raising awareness over the years.
Well, firstly, thank you for having me on this show. I've spent over 20 years carrying out research in the UK, but across the world, based at the University of Bedfordshire. My research focuses on how we can increase the conversation around organ donation. I also have the privilege of serving on the government's Transplant 2020 stakeholder group, which I chair, and that group is tasked with raising the conversation around organ donation. So it's an absolute pleasure to be here.
And you've done so much work with a lot of faith groups, I know, so we're going to get into that a little bit more later on. Now, we know from data with the National Blood Transplant Alliance and various organisations that transplantation is a huge issue in terms of the need for organ donation. And currently there are, 7,000 people on the waiting list. We also know that in the UK, a high percentage of that figure represents people from cultural backgrounds and faith groups. Why is there such a shortage? Can you just give us some insight into why that is?
Yeah, you've raised a really important problem here. 10% of the British population is from Black and Asian backgrounds. However, quite worryingly, 30% of the kidney transplant waiting list is from Black and Asian backgrounds. So we're 3 times overrepresented for kidney, and that's because of issues around diabetes, high blood pressure, kidney failure. The same is true for the liver, the hearts, the lungs. We have an overrepresentation of non-white communities, and this is all to do with we need to have better prevention and management of long-term conditions.
And so there's an aspect of being proactive, some preventive work that needs to be done with the individual themselves.
Yes, so I think we need to do a lot more work in terms of promoting health and well-being and also taking more responsibility in terms of looking after ourselves if we do have a long-term condition such as diabetes, as well as obviously the health service doing something for us. There's quite a lot we can do in terms of managing our diet and lifestyle.
Yeah, that's right. Now, the data also shows that in any given year, 1,300 individuals will die whilst waiting for an organ donation. Now, a lot of that represents, again, people from cultural backgrounds. Why is there a specific sort of dearth of organs available in specific cultural groups?
Well, I think most members of the public are not aware that organ transplantation is far more likely to be a success if organs come from the same ethnic background. And that's all to do with tissue type and blood group matching. So statistically, an organ from the same ethnic group background is more likely to be a match. It's not to say that, for example, an Asian organ can't go into a white person or a black person. It's just that statistically it will be more likely to be a match. So we have a current shortage, and that's mainly to do with lack of awareness in all communities.
And that's really quite sad when you think about it, that people are dying whilst waiting for an organ donation. Now, we know the work of the National BAME Transplant Alliance and other groups have been campaigning, have been working tirelessly to raise that. Can you talk a little bit about what they're actually doing, some of the awareness building programmes?
Of course. So the Alliance have been very good at trying to promote the conversation around organ donation. So they've been working with particular faith and community groups to start having some conversations strategically about, well, if we want to talk about organ donation within your communities, how do we do that?
Now, let's talk a little bit about faith. We know that there are some barriers around cultural perspectives, practices and faith. What are we doing to sort of bring the conversation into those faith arenas, and how has that worked so far?
Sure. So I was privileged to be commissioned by NHS Blood and Transplant to lead the Faith and Organ Donation Action Plan, which has now been published. So that's the first time in this country that all faith communities and their leaders have been engaged in a conversation. And Sharon, you were very generous to give up your time for that conversation and represent the Seventh-day Adventists. And those conversations have been enormously helpful. And what they've shown is that actually we're all human. We have a range of opinions on all sorts of issues, and actually organ donation is no different.
Yeah.
So what we're finding is that in all faiths there's a range of opinion, and that range of opinion shouldn't be surprising, because most scriptures, be that the Bible, or I'm a Sikh, so the Gurch Randhawa or the Quran, they were written hundreds if not thousands of years ago, whereas transplantation is a recent phenomenon. So we're finding that people are interpreting their faith in a range of ways. And that's the conversation starter. And what we're now doing is talking to people and saying, well, how does your faith view organ donation? But just as importantly, how does your faith view the receipt of organs?
That's right.
So, for example, we've talked about the huge transplant waiting list in this country, and some of the conversations you and I have been part of is, well, is your faith supportive of organ donation? And if the answer is no, does that also mean your faith doesn't support the receipt of organs? And if that is the case, therefore maybe we should be saying to our congregation they may not want to be on the transplant waiting list. So what this illustrates is this is a very complicated issue that needs lots of deep, meaningful conversations and won't have overnight solutions.
And I think if you look at it, when the only option is death, you know, if somebody's faced with an emergency and they've not sort of been an advocate for organ donation before or been a recipient, and you're faced with a life and death emergency situation, have you ever sort of raised that issue about, okay, if you're not pro-donation in terms of giving an organ or receiving, and you're at the point of death, would you reconsider? Has there been any change around people's,
Yes.
how they view it?
So I've been doing a lot of work internationally. So in some countries, Israel is the best example of this. They've actually introduced a system whereby if you're on the organ donor register, you are actually given extra points towards the waiting list if you ever then needed a transplant. And the reason they've introduced that is for exactly your reason, is because in Israel what they were seeing was that particular communities of Jewish descent were not taking part in organ donation, but were quite willing to receive, whereas other Jewish communities in Israel were both donators and receivers. So by now introducing a system whereby you, if you like, you are given additional priority if you are known to be on the organ donor register, they are now seeing a whole country increase in organ donation registration. So that does start to have a better impact in terms of this, if you like, conversation that people are having. Well, why is it that you're willing to receive but not willing to donate? And I think faith communities are a very safe environment to have those conversations where you are saying to people, we're not judging you. We know this is complicated. We know this is full of ethical and moral dilemmas, but we need to have these conversations.
Now, let's talk a little bit about the actual transplantation. There are a lot of misconceptions about what actually happens. Now, can you share with us some of the myths that you've heard about people's reticence about coming forward for organ donation? What does it involve? What does it entail? There's still a lot of fear and a lot of mystery around that.
Yes.
Can you sort of give us an insight into how to address that and what some of these issues are?
Okay. So I think the first thing to point out is it's quite normal to have concerns about organ donation because it's an issue related to death. So our research has shown, and this is not just in one community, this is in all communities, that most concerns and myths are the same. So the first concern most people have is they genuinely believe that if they're on the donor register and that's known to the hospital staff, they genuinely believe the staff then won't try and save their lives as much because they think they just want their organs. Now that's completely incorrect. The team who look after people during life are completely different from the organ retrieval teams. So we need to correct people of that misunderstanding, but the way to do that is to have these normal conversations. Other people are genuinely concerned about what their body will look like if they've donated their organs, because in a lot of cultures it's the family members and loved ones who do last rites, wash the body before either a burial or cremation, and dress the body. So they have concerns about that. Other people feel very strongly about the body going whole. So again, we have to have these conversations. And actually what you find is most people, what they want is the soul to live on, not the body. So actually the body being whole is less of an issue rather than the soul. But a lot of these myths and conceptions, we can also take back to the fact that, well, do these myths and conceptions then still apply if you needed an organ? If you or your loved one needed an organ, would you still have these misconceptions?
Yeah. So that's made it clear a little bit about busting those myths, so to speak. Now, with the situation as it is currently, what would you like to see happen?
I think the key has to be that we have to make the conversation of organ donation a normal conversation.
Yeah.
This programme hopefully will get people to start thinking about organ donation, hopefully will encourage people to talk about this programme with their family members, with their loved ones. But ultimately, I think we need to learn from other countries whereby they've got the conversation of organ donation going in their national media, their local media, the schools, the colleges, the universities, the employers. That's the way forward. We've got to have this as a natural conversation to everybody have.
And I think there is still some taboo around death. Speaking about death, we don't normalise conversations as much in this country around death and dying. Do you think if we were able to put that out on the table and sort of demystify it and make it a little bit more about, yes, we're celebrating life, but death can happen at any time. If we normalise the conversations around death, do you think that might give a little bit more openness to embrace issues around donating?
Absolutely. I think people underestimate the amount of distress their family will have at the time of their death. So I think the more we can bring those conversations forward, if you like, and talk about death and how people want their cremation or funeral carried out, what they want to happen to their body or their possessions. So in the same way some people openly talk about how they're going to prepare their will, we want people to openly talk about how they want their organs looked after.
Yeah, great. Now, do you find the same sort of reticence around blood donation and stem cell donation? Are there any differences in the way the cultural groups and faith groups respond, or is it the same sort of challenges with organ donation as with blood transplant and stem cell?
So there is a shortage of blood donation and stem cell donation and embryo donation amongst the Black and Asian communities. However, the challenges appear to be less so, that we've been doing a lot of awareness raising through the National Blood Service, through Anthony Nolan, and we're getting a lot more progress. But I think organ donation, the unique issue is it's related to death.
Yes.
So I think people are more squeamish to think about not only their death, but the death of their loved ones.
Yeah. Now, we've spoken a lot about the challenges. Let's talk a little bit now about the progress. Now, are there any organisations or faith groups or charities that you have seen that have been really proactive in terms of raising awareness about organ donation? What have been some of your experiences?
Well, I think it's been absolutely fantastic, the work we've seen through the National BME Transplant Alliance. So, I know you're a very modest individual, but you and I have taken part in a lot of events through the Seventh-day Adventist churches, and they've been fantastic events because the communities have designed those events. They've thought through very carefully about the congregation who's going to attend. They've thought through very carefully about having speakers from the community. So, you've kindly located individuals who've needed a transplant or have donated a kidney or have tragically, lost a loved one, but again agreed to donate their organs. So having the right messengers has been crucial for those events. We've also seen the Hindu community do a huge launch at Neasden Temple, which is, a huge, immensely important venue for the Hindu community in the UK. And they've also produced their own DVD. The Muslim community are doing a lot of peer educator work with Kidney Research UK in Birmingham and now in Scotland. Yes. And they're actually now leading a huge Muslim faith engagement work stream. And the Church of England, as you know, the Bishop of Carlisle, who is the Bishop for Healthcare, he actually writes about organ donation on the Church of England website.
Right.
So there's lots of activities, and we want to see more of that in all faith communities.
That's great. And it's nice to be able to plot the milestones where progress has been made. Where do you think we should be going next, and what your appeal would be in terms of organ donation?
So I think it's important to recognise that in the UK we made huge progress. So in 2008, when I was on the government donation task force, we set an aspiration to increase the number of transplants by 50% in 5 years. And by 2013, we'd achieved a 50% in organ donation in 5 years, which is, worldwide, that's remarkable. The challenge, though, is the family consent rate, which in this country has been 60%, in Spain it's 80%, has remained at 60% in the UK year after year after year. And the worry for me is in the Black and Asian community, that consent rate is actually only 40%. So in the white community, it's nearly 70%. In the non-white community, it's 40%. And what we need to do is do far more events in the community, in the churches, in other places of worship, in routine places like places of employment, places of education, and the media, so that we get families talking about organ donation all of the time, and also talking about what their position is on the receipt of organs. So we do understand that this is a two-sided debate, that if you don't support organ donation, how can it be that you support the receipt of organs? And I think we need to have these open conversations, but in a safe environment.
That's right. And finally, the National BAME Transplant Alliance, the coordinating voice for organ donation in the UK. The board we sit on, what would you give as the final message from all of us from that board about what we want to see, what we want to do to raise the flag for organ donation, blood transplantation and stem cell in the UK?
I think the big message for me is the Black and Asian community are probably the most generous communities when it comes to any cause. It could be worldwide disasters, and you normally see Black and Asian charities, churches, places of worship all coming forward to help. So I think whenever there's a need, we're actually world known for our generosity, and I would want the same generosity to be symbolised for organ donation.
Professor Gurch Randhawa, thank you so much for being with us today and for shining the spotlight on why organ donation is so important. Thank you.
Thank you for having me on.
Bless you.